Well, for some time, ever since I was a nurse, I've been concerned about care of elderly people in hospital. I mean, elderly people are not some interruption to our daily work, and I used to get very distressed when I heard people talk about inappropriate attenders or bed blockers, and actually this is everybody, and it's how we care for our older people in society, I think, is a mark of who we are as a society. So I've always had a passion for how we look after older people, and this was to be a simple way of helping organisations improve the care they provide for our older people. We've got lots of ways of getting feedback from patients, their carers, their relatives and friends about care, so overall it will contribute to the improvement of that care for older people in our society.
We thought that the care that frail older people receive in hospital had obviously been very high profile with the recent scandals at mid-staffs and the Francis report. As a consequence of that, we thought there was a really good opportunity to work with the HSJ to spread good practice around how care for frail older people could be enhanced. And essentially, with our ageing population and the demographic challenges, frail older people are the main people who are going to be in acute hospitals over the next period, and it's really important that we provide everyone with the best quality care that we can.
So I hope that the great mix of people we have on the Commission can bring different perspectives. So we've got obviously a lot of people who are experts in geriatrician care and experts in hospital care, which is fantastic. We've also got sort of economic, private sector, voluntary sector input, and I think what needs to change is it covers all of those elements. I hope the Commission can make a difference by cutting through some of the large volume of existing evidence and providing practical support, practical ideas, practical advice, and simplifying for trusts, in particular for boards, kind of what the key areas are that they should focus on.
A lot of what was being discussed was what the NHS might do 3, 4, 5 years into the future with the delivery of community care. We wanted to put together a commission that would be very practical in its outlook and tackle the issues facing the NHS right now. There are 2 ways to determine success. One is to bring to the front of mind of policymakers the specific challenges the NHS faces, so that when they are thinking about how they may change the NHS, whether they're in government or maybe in government, they take that into account. And the second thing is that I hope the Commission will produce many practical examples of good practice that NHS provider and commissioner organisations can take up.
So this Commission has tried to have a relentlessly practical focus in everything that it's doing. One of the key tools that we've developed so far is a range of questions. It sounds like a very simple thing, and it is a very simple thing, but it's designed to help boards and to help staff in trusts really think about the practice that goes on within their organisation and actually benchmark it against really good innovative care that's being delivered right now across the NHS and in partnership with the voluntary and the private sectors. Possibly one of the risks that emerges in the wake of the Francis report, which famously had nearly 300 recommendations, is that you can seek to move towards an almost tick box form of compliance. The Commission's view is fairly strongly that what we actually need to see is organisations develop the capacity to improve themselves rather than have improvement or certain benchmarks which may be arbitrary and may not have great relevance to some organisations imposed from on high. So we're aiming to produce very practical tools which can be taken right down to frontline staff and will be expressed in very clear, very usable language and get them into use in that way. And one of the aims of some of the questions which we're developing and some of the tools which we're developing is to empower the non-executive directors on boards to ask insightful, thoughtful questions which actually have practical, rooted meaning, and therefore to actually enable conversations about improvements in care to be much more iterative, happen much more frequently, and that is almost certainly likely to improve the possibility that care for frail older people in hospitals will be improved.